Students should be able to identify and demonstrate the important bony landmarks of posterior aspect of upper limb at the end of the session. The surface landmarks from the posterior aspect of the superior extremity includes the crest of the scapular spine, acromion angle, inferior angle of the scapula, apex of the olecranon process, posterior surface of olecranon process. The inferior angle of the scapula can be felt at the level of 7th thoracic spine when the medial border of the scapula is traced downwards. This overlaps the 7th intercostal space. The spine of the scapula, or it's also called as the scapular spine, is a prominent plate of bone which crosses obliquely in the medial 4/5 of the scapula at its upper part and separates the supraspinatus fossa above and the infraspinatus fossa below. To feel for the scapular spine, first feel the inferior angle of the scapula and move the finger upwards across the medial border and feel for the base of the spine. The crest of the scapula can be felt as it is subcutaneous throughout. So it runs downwards and medially to reach the medial border of the bone opposite the 3rd thoracic spine. This forms an important landmark at the back for the starting point of oblique fissure of the lung, about 2.5 centimeters lateral to the 3rd thoracic spine. The acromion angle is located where the lower border of the crest of the spine of the scapula meets the lateral border of the acromion process. The apex of olecranon process. This can be felt well to the inner side of the midpoint of the interepicondylar line in the extended elbow. The medial and the lateral epicondyles along with the apex of the olecranon process, it forms an isosceles triangle when the elbow is flexed. The posterior surface of olecranon process, it is subcutaneous and tapers downwards from above. The head of radius, it is situated below the lateral epicondyle of the humerus in the depression on the lateral side of the olecranon process. So it can be felt to move during the pronation and supination of the forearm. The head of ulna, it forms a rounded bony elevation on the medial side of the back of the wrist in the pronated hand. The styloid process of the ulna projects downwards from the ulnar head at the median side of the wrist.